It's very exciting to be working with Trukera, a company which has built on the foundation of TearLab with tear osmolarity, bringing us a new generation of device, the Scout Pro device, which takes the fundamentals of the TearLab device that allows us to streamline the procedure so that we have the analysis right on the handheld device itself, saving us a lot of time and increasing efficiency in the clinic. And it's also nice to work with a company that is not just pinned to one diagnostic test. They are committed to growing the corneal health space with acquisition of new technology and new products to help improve our diagnostics and treatment of corneal issues. Thank you. It is very important for us as ophthalmic surgeons when we're counseling our pre-surgical patients to talk to them about their ocular surface and their expectations following the surgery. Diagnostic tests that we have available, such as the Scout Pro by Trukera, can help us look at osmolarity as a parameter of the health of the tear film in the ocular surface, which has a very profound effect on what we can expect for our patients postoperatively. It can help us diagnose and monitor our dry eye diagnosis, and also help us monitor the stability of the tear film, which is really crucial for the accuracy of all of our preoperative measurements for cataract and refractive surgery. As we know, an unstable tear film can produce irregularities in the tear film and the accuracy of all of those measurements, which can have a profound effect on our postoperative results. We know that there's significant light scatter that is produced by increased osmolarity. So again, stabilizing the tear film, reducing osmolarity, improving the health of the tear film will provide for us more accurate, more reliable results for our preoperative measurements, a more accurate, on-target result for our patients, and a faster and more comfortable visual recovery following surgery. One of the important things to remember about increased osmolarity is that it's not just a lab test, which is a marker for patients who have dry eye or an unstable tear film. It's been shown, a great study by Dr. Epitropoulos showed us that the light scatter that is produced by increased osmolarity can have a profound effect on our postoperative results. And I think they found that 1 out of 5 patients postoperatively ended up off target if they had preoperative increased osmolarity. So it's important for us to look at this as an important marker of the stability of the tear film to ensure accuracy of all of those measurements preoperatively. And this is especially important in our premium IOL patients, but for any patient, of course, we want to end up on target. So this is an important parameter for us to look at. So I have used the TearLab device to measure osmolarity for many years now, and I'm very excited to see this next generation of the device, the Scout Pro device, make it into my clinic. I don't have it yet, but I'm looking forward to it. One of the real advantages is that it addresses the problem with the original TearLab, which was that you had to bring the device back to a base station in order to get the result. With the Scout Pro device, we have the readout right on the handheld device, which is actually a little bit smaller and a little more comfortable. So that allows me to increase in efficiency with my technicians in the clinic. They don't have to run back and forth from the patient lane to a base station. They can take the reading. They have the readout right on the device. It takes something like 40 seconds or less to do 2 eyes. So this way we get the information without disrupting my flow or adding time into the workup for our patients. I think we all know that our patients that we are considering for premium IOL surgery, a multifocal IOL, a toric IOL, an extended depth of focus IOL, those are some of our most demanding patients. And it is absolutely crucial that we hit the mark for those patients. We end up on target. One of the most important factors that can throw a wrench in the works, so to speak, is that unstable tear film that patients have preoperatively. It can interfere with the accuracy of their measurements. It can interfere with their postoperative quality of vision or their overall recovery. So it's really crucial that we have good tools like the Scout Pro for tear osmolarity in order to help us diagnose unstable tear film, dry eye, and help to ensure that these patients get treated preoperatively, because those patients are expecting perfection. They are the most demanding patients. So we have to make sure we diagnose ocular surface disease preoperatively. We have to talk about that with the patients, get them invested in the issue of dry eye so they are motivated to help improve the surface, to heal the ocular surface, and improve the stability of the tear film, and importantly, maintain that investment postoperatively to continue the treatment so that they continue to have their best result preoperatively. If we don't diagnose it preoperatively and we take a look postoperatively when there's a problem, then the patient's upset, the doctor's upset, the patient thinks that we caused the problem. So again, very important for us to look at it preoperatively, use good tools like tear film osmolarity, which takes just 40 seconds to do both eyes, in order for us to make that diagnosis and invest the patient in their preoperative measurements and their postoperative result.